So this is what I'm talking about here. And as I made the 7/10 millimeter thickness that area. Okay, so make this as good as possible. Okay, this is final crown view. Natural lifelike restoration. You just saw the patient's mouth we try in. Beautiful restoration. And a great emergency profile just like that. Awesome. This is from the wax up. Exactly what you want, the wax up. And then we prefabricate it temporarily and then make a little bit bulkier. And then this is the final restorations. Beth is here. She is really concerning about the anterior cases. The crown, I hate to say that other laboratory made it, and she doesn't like it. It's some trauma. So we're trying to make this as best as possible. So that's why we can videotaping today. The preparations. I like the tooth color, which is slightly differentiation between the teeth color, which is okay with that. The problem is the ingot selections. Doctors and I talk all the time regarding the lifelike restoration all the time, which is a hit and miss. And sometimes the one prep is really dark, the other prep is light, and then some preps are sticking out in dark. That's the problem. So in order to make these cosmetic is a blending, is natural lifelike. I'm talking about natural as possible. That's the key, right? Dentists have to make their great preparation, and also the prep color they have to considering, just like Dr. Barrera in Illinois, Michelle Barrera. I finished the restorations, this crown, and it's like that. What I'm going to do, I'm going to put some Vaseline inside and then stick it. Then it's not wobbling. So like I said, this one, I'm going to put some of the Vaseline inside. Okay, a little bit. It's clear. And then I can apply the patient's mouth. Not a lot. Okay. And then I put it into the patient's mouth. Okay. And then here's more. Just like that. 3. So regular Vaseline is okay, but must be cleaned out after that. Sandblast it. Very important. The reason I do that, I want to get the symmetry. But the same page is not slightly differentiation between the teeth, which is I don't like that. Okay. Okay, trying. Oh, I'm sorry.
Okay.
This is 2 teeth. It's pretty, right? Okay. This is like restoration. Does not look like PO, OM2. Made slightly out the vocal corridor for premolar. Alright, hold on 1 second. Which is what I like, this is emerging profile, that's why she mentioned it. Alright, that's the other side. Yeah. There's nobody looking at the other side. I know what she's talking about previously. That's the emerging profile, and then inside the view, and then match it. And we choose the shade guide selection, right? Which is the variety selection. That's why we fabricated natural as possible. That's why dentists don't know. Just made the custom zirconia restorations. This fantastic one. That's another key for success. Now is more mirror. Yeah. That's what I'm seeing, the natural purity, the color restoration. It's not look like beta shade tab.
Yeah.
It's look like teeth.
Yeah.
Looks like teeth, right? This is a custom. That's what we call, what's the call? Signature.
Oh, they look
Okay.
really beautiful.
Okay, that's cool.
So good.
I wish Dr. Michelle Barrera can see this one's final shot,
Yeah.
so she can utilize it only the clear cement, clear color cement, right? So see, remember
Yeah.
what I did with the Vaseline.
I'm trying to keep it, yeah.
Thank you. So first what I did is a great emergence profile. Okay, so make the looks like the her natural form, and she gave me the photo previously. The demo is really helpful. So when long time ago she wear the anterior teeth, which is zigzagging, but I see the contour, the facial contour, so I made it always a little flat, toward to lean to the major corner, and then finish him up. And then I like this balance, and then I like this symmetry. Even tissue contour slightly difference, but she's not noticeable. All right, because tissue is great,
Yeah, beautiful.
and
Really
that's the
good.
signature cases. All right, you're happy now, right?
Yes. Thank you.
Thank you.
It's so good.
Thank you.
Thanks.